Good afternoon and welcome to Dr. H.S. Adenwalla Memorial Oration 2022. I request the dignitaries of oration to join on the stage. I request Dr. Firdaus Adenwalla, Reverend Father Francis Pallikunnat, Dr. D.M. Vasudevan, Reverend Father Renny Mundangurian, Reverend Father Devin Tarayil, and Dr. P.V. Narayanan to join the stage. We'll begin the program with a prayer. I request the prayer group to kindly come forward.
Come take my eyes, O Lord, may they shine with joy. Take them for your service, Lord God. Come take my eyes. Come take my eyes, O Lord, may they shine with joy. Take them for your service, Lord God. Come take my eyes. Come take my eyes, O Lord my God. Come take my lips and all they speak. Come take my feet and all they walk. Come take them all. Come take my hands and all I do. Come take my heart and all I love. Come take my life and all I have. They are all yours. Come take my eyes, O Lord. May they shine with joy. Take them for your service, Lord God. Come take my eyes. Come take my eyes. Come take my eyes.
Reverend Dr. Demin Tarayil, Assistant Director of Jubilee Mission Medical College and Research Institute, will welcome the gathering.
Marcus Garvey, a Jamaican orator and activist, once said, "A people without knowledge of their past history, origin, and culture is like a tree without roots." Dear friends, today we, the Jubilee family, gathered here to remember our humble origin and to hear about two strong hands joined together in building up this institution from a small dispensary to a 1,500-bedded hospital. Monsignor Mathew Muringathery, the founder director of the Jubilee Mission Hospital, dedicated almost half of his life, 40 years, as the director in upbringing this institution. He is remembered for his commitment to develop a healthcare missionary organization in Thrissur, far-sightedness to setting up a poor man's hospital with super speciality and developing a healthcare culture with mission of transforming lives with love. Along with him, in 1959, just after 7 years of conception of Jubilee, a young doctor, a full-time doctor joined here in Jubilee, Dr. Hirji Adenwalla, a true medical missionary who created real smile in the faces of many. I am not the right person to talk about him. Today, we have the right person here to speak about his father. Dr. Firdos is with us. He will talk about his father. And also he is an expert in geriatrics. He will talk about the topic on geriatrics also. Anyway, we are so happy to welcome Dr. Firdos to this oration. Hearty welcome. Today we are conducting the first Dr. Adenwalla Memorial Oration. I told first means it will be continued every year. It will be continued every year in memory of Dr. Adenwalla. Every year we will conduct an oration on different topics. Today, this year, we have Dr. Firdos with us. Next year, there will be somebody else will be delivering this oration. Dr. Narayanan will introduce Dr. Firdos. He is the right person to do that. A warm welcome to Dr. Narayanan. Our director, Father Renny Mundagunian, is here. Our former director, Father Francis Pallikunath, is here. A warm welcome. We don't need to welcome them to our Jubilee family, but we welcome both of you to this function. Dr. Vasudevan, our research director, he will be making the concluding remarks today. A warm welcome to Dr. Vasudevan. Today, three families are gathered here. The Jubilee family, the Smile Train family, and also the family of Dr. Adenwalla. In small words, I welcome all of you. The three families, Jubilee family, our old sisters are here. Many retired staffs are here. It is our family, our Jubilee family. So a warm welcome to Jubilee family, Smile Train family, Dr. Adenwalla family. Thank you.
Thank you, Father. Dr. P.V. Narayanan, HOD, Charles Pinto Center of Jubilee, will introduce the speaker of the day, Dr. Firdos Adenwalla.
Good afternoon, everyone. It is with the greatest pleasure that I introduce my good friend, Dr. Firdos Adenwalla, to deliver the first Dr. H.S. Adenwalla Memorial Oration. He had his basic medical education and training in India. After completing his MD in general medicine from the Kasturba Medical College in 1994, he went to Mumbai to get trained in intensive care under the great Dr. Farooq Udwadia at the Breach Candy Hospital. Thereafter, he went to the UK, where he completed his MRCP in 1997 and subsequently his FRCP in 2007. Since the year 2005, he has been working in the UK as a consultant in geriatrics and in general medicine. His special interest has been on the prevention of falls in the elderly. He is keen on providing acute and subacute medical care in people's homes, and he has pioneered the setting up of the first hospital at home services in the UK, a true chip of the old block. His wife, Mrs. Jyoti, is a specialty doctor interested in Parkinsonian movement disorders and in the assessment and management of memory impairment. They have two children. Shana, the elder of the two, is a doctor and a budding nephrologist. Sarosh, the son, has done his master's in mathematics from Warwick, UK. Ladies and gentlemen, Firdos Adenwalla.
Thank you, sir. Now we have the oration by Dr. Firdaus Adenwalla on the topic Geriatrics in 21st Century. I request the dignitaries on the stage to take your seat in the audience.
Thank you, Dr. Narayanan, for the introduction and for patiently responding to all my queries while I was preparing for today. I think the first time I was thankful for WhatsApp. Good afternoon to Father Reni Mundankurian, Reverend Father Francis Palikunath, Dr. D.M. Vasudevan, and Reverend Dr. Demin Tariyal. Hello and good afternoon to all the audience, and thank you to everyone for making the time to be with us here today. I would also like to thank Dr. Varghese, Dr. Alex, and everyone in the organizing committee who have worked hard to bring us all together. I'll first like to a short presentation just remembering my dad, and then we'll go on to the oration. I would like to start by sharing some thoughts with you of my father, and to do so, briefly take you back to 1964. Yes, 57 years ago, I was born in this hospital. My younger sister was born here 52 years ago, and so was my daughter, 28 years ago. The person who brought her into this world is here with us, still working here, as there are a number of other familiar faces who have kept this place alive and the spirit of this place alive and well. But the hospital has changed beyond recognition, and the only familiar landmarks are the Divi tree and the cannonball tree. Both were just outside a garden wall and now at the entrance of the cardiology department. The trees provided shade and the wall a comfortable seat for taxi drivers, friends and relatives of patients, and just other people who just wanted to pass the time of the day. It was clearly a meeting place to discuss everything from politics to local gossip, and at times the chatter could get quite loud and disturb my father, who on certain afternoons would come home to rest. His method of getting peace was, to say the least, a bit unconventional. A syringe would be filled with water and squirted from his bedroom window in the general direction of the noise. There would be a scurrying of feet, an innocent bird would get the evil eye, and silence would descend for a short while. My dad would be like a naughty schoolboy in a playground, chuckling away long after the deed was done. As a family, we were reminiscing about the good old days, and my mom was telling us about their first journey by car from Ahmednagar, the city where both were born and brought up, to Thrissur in 1960. They stopped over at Mysore, as my dad was keen to see the Maharaja's collection of Rolls-Royce cars. Apparently, the Maharaja of Mysore bought these cars in multiples of 7, as he considered 7 a lucky number. So they rolled up at the gates of the Maharaja's palace in their lime green ambassador, piled high with luggage, and my dad asked the guard if he could see the collection. Naturally, he was refused entry. Disappointed, my father turned to leave when, as an afterthought, the guard asked him if he was the person who was supposed to see the cars with the view of buying one. Without batting an eyelid, he said yes. My parents were given a VIP guided tour of the collection, my father taking his time and asking questions like a true professional. My mother, meanwhile, was anxiously looking over her shoulder, wondering when the actual buyers would appear. But then she knew when she married him that she was in for the ride of her life. May not be in a Rolls Royce, but 1,000 times more interesting, joyful, and exciting. It's not easy to define my father. Mind you, there are many words in the English dictionary that describe him: kind, compassionate, dedicated, patient, modest, wise, and brave. always on the side of the underdog, generous, honest, a brilliant surgeon, teacher, student, and humanitarian. Unashamedly, I can go on. All this and more wrapped up in a warm sense of humor, peppered with lots of fun and laughter. The difficulty is to imagine all this beautifully woven to make one person, so unassuming that unless you knew him well, all you would notice is a man in a slightly bizarre outfit of white shorts, ankle-high black boots, white socks, and a white hospital collarless top. One of his colleagues, a maxillofacial surgeon from Kochi, recounts his first meeting. He was visiting JMH for the first time to invite my father for a conference. The following are in his own words. I promptly reported to the theatre complex at 12 noon and was bewildered to see that there was no one there except a fair, bald man in a white sleeveless banyan and shorts sitting on a stool on the side of the theatre entrance. I looked at him curiously and made my assessment. This man must be some saip who must have been admitted to the psychiatry ward of the hospital and escaped from the ward and found a comfy place on the stool in front of the theatre. Well, all stories have a beginning, and my mother's and his were entwined long before they came to Jubilee Mission. Their story starts in the city of Ahmednagar, in Maharashtra, a city rich in ancient Mughal history, and this is where they were both born and brought up. My mother, you could say, was brought up in the lap of luxury. My father had a more modest upbringing. She was a fun-loving teenager, while he was more interested in literature, poetry, and history, even writing a book on the history of Ahmednagar. But clearly something attracted a young, carefree teenager to this serious young man. He read extensively and came across biographies on great medical missionaries like Paul Brand and Ida Scudder. And this, along with his love for humanity and his strong sense of justice, led him to apply for a job in a small mission hospital in a town he till then did not know existed. The senior members of the family were not exactly happy with the idea of my father, with his 19-year-old bride, setting off some hundreds of miles away. In fact, my mother recalls that when she was busy packing for this journey of her life, her mother-in-law advised her to just take the bare essentials as she prophesied that they would soon be back. Well, mother-in-laws are not always right. The early years in Trishur were, to say the least, not easy, both for the working and living conditions were basic. My mother had to quickly get used to a small house with no running water, ceiling fan, or telephone. She could barely boil water and had to contend with the wood fire for cooking. The learning curve was as steep as they come, and even got steeper when she realized that she was responsible for the family finances, when she did not even know how to sign a check. My father had to contend with his own set of challenges, a poorly equipped hospital and lack of staff. He was the only doctor after 6 p.m. when emergencies came in. He took on the role of the X-ray and lab technician, doing his own X-rays and blood tests. My mother recounts an amusing incident. It happened at night, about a week into their stay. She was not settling down too well, feeling nervous, lost, and homesick. She could barely sleep with the fear that bandicoots and civet cats running around above the false ceiling would fall through and join her in bed. She suddenly felt a presence in the room and woke to find a man standing by the bed. She let out the scream of her life. My father had forgotten to warn her that the lack of a phone meant that he could only be notified of an emergency in person. Anyway, the next day she had a lock installed on the front door. My father coped as he was well trained most of the facets of general surgery and orthopedics. In fact, in the early days, he was also the resident obstetrician. In addition, fortunately, he was adept in anesthesia, for a while there was no anesthetist. So my mother, besides being his wife and secretary, was trained to take up this role. What made them get through those initial difficult years? Besides, of course, a desire for my mother to prove her mother-in-law wrong, was their determination, their sense of adventure, and the realization that my father had found his calling. He always told me that the joy you get out of helping someone most in need is like no other. What was equally instrumental in making them stay was the determination and dedication they saw in Father Mathew, the then Father Director, and the small team of sisters and other staff. It was clear that they were going to do whatever it took to grow and develop the hospital into an institution that would provide good, effective care for those less fortunate. It would be remiss of me not to mention the kindness shown in those difficult times for the people of Thrissur, for the bank manager, the shopkeepers, to Ford John, who ran the local car workshop. His name was actually John, but he was called Ford John as he bought the first Ford car into Thrissur. My father was a bit obsessive about his car, and the tiniest squeak or rattle would mean a call to the workshop. Given the state of the roads, this meant the car was more in the workshop than at home. But 3 generations of the Ford John family kept his mind at ease. I think this story says a lot about the community coming together in those times. It was during one of the many strikes by the electricity department, except this was prolonged, and the theatre had to close down as the hospital did not have a generator. One day, my parents spotted a Kaja BD van in town advertising BDs. BDs, for those not aware, is a cheaper form of cigarette. It was festooned with twinkling lights with music blaring from a loudspeaker. They realized the van had a generator, and I met the owner and explained the predicament. The next day, the van was parked outside the theatre, twinkling lights and all, providing electricity which got the lights and machines working. A most unusual place to advertise BDs, but on this occasion, it was also saving lives. The hospital grew by leaps and bounds. It rapidly became a multi-specialty hospital with an excellent reputation. The dedication and hard work of so many doctors, nurses, sisters, and staff that made this happen. The late Dr. Varghese Paul, who started the medical department and nurtured it to become a dynamic unit, looking after the entire gamut of medical problems. Dr. Achapilla for gynecology, and so many, many more who put their heart and soul into this institution. People look a bit puzzled when I tell them my sisters and I, along with other doctors' children, were brought up within the walls of a hospital. I think there was something about our childhood that gave us an early insight into that circle of life, the profound unfairness in society, and an appreciation of what we had. When my sisters and I think back at our childhood, the feeling that comes over us is one of happiness, fun and laughter, a sense of peace and security. We are so thankful that Netflix, Amazon, Facebook, and Instagram are not on the scene. And we did not have to fight imaginary monsters on Xboxes. If I got bored, I would wander into the operating theatre to have a chat with Sister Octavia, Clavira, Theatre Mary, and other theatre staff. Smell the intoxicating aroma of disinfectant. Drink that lovely sweet coffee. I hope it's still served. And maybe gown up to watch an operation. We fondly remember eagerly waiting for the click of the gate that heralded my father's return from work. We would gather around, listen to the stories of the day. My father would weave his magic with words and tell us about the patients he saw. Stories that were sad, happy, and funny. This is how he taught us about life's lessons. At that time, we did not realize that we were learning. I suppose that is the best way to learn. Unlike when I tried to teach my children the same lessons, they knew there was a lecture around the corner and would roll their eyes to the ceiling and breathe a deep sigh. He did try and embed in us a clear sense of right and wrong and sense of fair play. He was saddened when he saw erosion of moral and ethical values in medicine, and when he saw financial gain given priority over patient care. He was not naive and realized that health care was very expensive business. His advice to me was, by all means, become wealthy, but do so with honesty and making sure that caring for your patients stood head and shoulders over monetary gain. He had a lovely sense of humor, always playing pranks and tricks on unsuspecting family and friends. Here he's on holiday in Kashmir. He had organized the grandchildren to pour water on family as they walked into their rooms. He was someone who was clearly content with his lot, someone who had that inner happiness and peace so many of us crave. He loved to see a smile on people's faces and would get up to all sorts of antics and make even the most serious person burst into laughter. There was never a dull moment when he was around. How many of you have had a Second World War veteran camp in your front veranda? Well, one day my father came home and said he met an elderly man outside the hospital. He was being teased by some children and they were having a laugh when he would try and give chase. He was penniless and homeless. It was said that he suffered shell shock during the war. His name was Daniel. I still do not know how my mother allowed it, but one day Daniel made his home on our front veranda. He laid out his meager belongings and became a part of our extended household. He was meant to only stay for a few days. The days turned into weeks and then into months. Then one day he disappeared and we never saw him again. Someone called my father Kalpavriksha, a wish-fulfilling divine tree. He would have his previous patients or even complete strangers appear in his consulting room or land upon our doorstep with a range of problems, be it health, financial, or worries about unemployment. They all received a patient hearing and many were helped with nothing asked for in return. One day a lady asked to see him. She was very upset as her son was not able to take his final exams due to a medical condition. She was unable to get a medical exemption certificate as a doctor wanted a bribe and she had no money. My father wrote a detailed letter explaining the medical problems and the lad was granted an exemption. He took his exams the following year, did very well, went on to become a doctor and moved to the US. We were pleasantly surprised to receive a lovely letter from him when my father passed away, relating this story. It read, "I'm the chief of division and clinical professor at Wright State University, a boy from a small town Trichur. With a lot of help from Dr. Adenwalla, I'm living the dream of my life." Yes, indeed. He had made many dreams a reality. Life continued in this slightly unusual but happy vein. The hospital expanded further. Work got busier. My father started one of the first burns unit in the area, and the surgical department developed with a team of versatile surgeons. This allowed him to focus on his passion, which centered around treating congenital craniofacial anomalies, most common being cleft lip and palate. And he named his unit Charles Pinto Center in honor of his mentor and teacher. Cases started pouring in from across the country. The vast majority were children from very poor families who could barely afford the cost of travel, let alone pay anything towards the surgery or for their day-to-day subsistence. The hospital tried to help, and my father did manage to get donations from various charities, but the money was never enough. He was getting despondent, as something which he had taken for granted, providing free treatment for those in need, was becoming increasingly difficult to deliver. And then out of the blue, my friend sent my father a newspaper cutting about Charles Wong and Smile Train. He wasn't impressed, as he had heard of organizations that sent surgeons from abroad to operate in India. They would return home, leaving a host of post-operative problems behind for local doctors to deal with. These doctors were not trained to deal with the complications. He threw the cutting into the bin. He did not realize that Smile Train had a different approach. Lao Tzu, a philosopher and founder of Taoism, said, "Give a man a fish and you feed him for a day. Teach him how to fish and you feed him for a lifetime." Smile Train had imbibed his philosophy and my father loved it. My mother retrieved the cutting from the bin, wrote a long letter to Charles Wong, and the rest is history. So here was my father at the latter end of his life, batting at 70 years with a new bat, but in the same old hands, all set for a new adventure. To say the Smile Train changed his life and the direction of the department would be an understatement. The organization trusted him implicitly, and the department was given the state-of-the-art equipment and resources to treat as many children as they could. It developed into one of the premier multi-professional units in the country. My dad, who till then was a bit of a medical recluse, rarely attending a conference, suddenly became a cleft celebrity. Invitations to speak at conferences and numerous awards followed, which included the prestigious Joseph McCarthy Award for Excellence in Medicine and Humanitarian Service. But what I think he most enjoyed were the numerous doctors and students who came from across the world to learn and watch him work. He loved the interaction, the debate, the discussion that would follow. people learning from each other to make someone else's life better. He firmly believed that knowledge did not flow from the elder to the younger, but could easily go the other way. I remember an excited 84-year-old telling me on the phone about a new technique to repair the palate that he had learned from a surgeon from Taiwan that gave better results than his. He at once got down to mastering it. His love for poetry, sorry. His love for poetry, literature, and passion for medical history kept his guests well entertained in between operations and would continue into the evening at their flat in Jubilee Retreat, which probably saw someone from every corner of the globe. Some were with him for only a day, others for a few more. As the years flew by, most stayed in touch, not to learn the craft, because they realized that they were in the presence of an exceptional human being. All the fame and adulation did not change him. He dressed and spoke and behaved as he always did. For the people of Trishur, he was still the doctor who wore shorts, the appapen, the grandfather who looked after their parents and grandparents and was now looking after their children. He had a good laugh when he told us the incident when a newly appointed security guard stopped him one evening in hospital and asked him where he was going. My father, as usual, saw an opportunity for a joke and said, "I'm looking for a job." The guard shook his head in pity and said, "You're too old. No one will give you a job." Yes, his other endearing quality was that he could laugh at himself. It's now a little over 2 years since he's passed away. It was indeed a very difficult time for us, even more difficult as my younger sister and I were in our separate COVID bubbles and could not be with him and the family. The amazing tributes that poured in were lovely to read and brought us laughter and tears as each person recounted their memories of him. As a family, we would like to thank you for sharing these precious moments, as they most certainly helped ease our grief. The tributes that flowed in called him a saint, a noble soul, a star, a man in a million, and so much more. For us, he was a simple person whose love for life was boundless and kindness immeasurable. A fun-loving, wise father and teacher whose gentle, clear voice still guides us through this busy, chaotic world. My mother found a piece of paper in a book where he would scribble a lot of his thoughts. The question mark seen following his date of birth indicates that he was probably contemplating his mortality. Here he has written how he wished to be remembered. He writes, "If you want to remember him, and if you must, then know this, he had but one virtue, he was kind." Thank you.
Thank you, Dr. Firdaus Adenwalla. I request Reverend Father Francis Pallikunnat, Foreign Vicar, Dolores Basilica, to present a token of our appreciation to the speaker. The oration will continue. As our father is having some work, he has to leave early. The oration will continue.
I would like to thank the Jubilee family for giving me the honor of delivering the first Dr. H.S. Adenwalla Memorial Oration. I'm a geriatrician. I live in Cardiff, which is the capital of Wales. It forms a part of the west coast of UK. UK is made up of Wales, England, Scotland, and Northern Ireland. Now, each is considered a nation, and the people are very proud of the fact and can get a bit touchy. So if you were to visit Wales, I wouldn't say something like, England is a lovely country, or even worse, England has an excellent rugby team. You will be testing the hospitality of the Welsh and maybe unceremoniously directed back over the bridge to England, and that's the bridge you see over the River Severn, linking England and Wales. Wales is small but has a lot going for it. It's famous for 3 C's: castles, coal, and choirs. The Welsh were always fighting with the English. We do have more than our share of castles. The ones in this slide are about 15 minutes drive from our home. At one time, Cardiff was the coal capital of the world, with coal mines dotted across Wales. And by the turn of the 20th century, it was the greatest coal exporter in the world. This building is the coal exchange in Cardiff, where apparently the first £1 million check was signed in 1907. And this red brick building is a pierhead building from where the heart and nerve center of the port. And this ship is the Terra Nova, in which Robert Scott set sail on that ill-fated journey to the Antarctic in 1910 in the attempt to be the first to the South Pole. He set sail from Cardiff as most of his financial backers were from this city. Final C's choir, testament to Welsh talent for music and drama. I think this small nation punches way above its weight in producing some very fine actors and singers. If we had more time, we could have a quiz on these famous faces, and there are a lot more. You also happen to have some spectacular scenery that can be enjoyed in the few days of the year that we have sunshine. Yes, it rains a lot in Wales. And that's my daughter, who thinks she's sitting on top of the world. She assured me it was safe. By now, you must be thinking that you mistakenly walked into a talk organized by the Welsh Tourism Department. But no, you're in the right place. But I have to tell you, the interesting bit of the presentation is over. I thought I'll tell you something about geriatrics in the 21st century. The term geriatrics from Latin, geron, meaning old man, itros, means healer. And before I went to the UK, my knowledge of geriatrics began and ended with the very entertaining Asterix and Obelix comics. One of the most entertaining aspects of the book were the names given by the author to the various characters, and the oldest man in the village was called Geriatrix, who also happened to have the prettiest woman as his wife, appropriately named Panacea. Everyone in the village was super strong due to a potion made by the medicine man called Getafix. Hopefully, I have not wasted all my parents' hard-earned money over the last 20-odd years and expanded my knowledge beyond what I've learned from comic books. I thought I would start with some history. Modern geriatrics is only 80, 90 years old, and this lady, Marjorie Warren, is known as a mother of modern geriatrics. She was a surgeon by training, and in the 1930s, the hospital she was working in took over a nearby workhouse. The workhouses in the bad old days were not nice places. Charles Dickens, who besides being an author was a social reformer, tried to bring these places to public notice in his books, the most popular being Oliver Twist. The dark and dingy workhouses admitted all sorts of people, the poor, unmarried mothers, the sick, and the elderly, and those with dementia. Anyone the society did not want was sent to the workhouse. Fortunately, these places were closing down, and this workhouse that Marjorie Warren took over had nearly 800 inmates. She systematically reviewed all of them using the modern principles of rehabilitation and got a lot of them back to work and their home, and she wrote 2 seminal papers in the British Medical Journal and Lancet advocating the creation of the specialty of geriatrics. So she was well ahead of her time. But what really gave impetus to the development of geriatrics was, as a specialty, was the founding of the National Health Service, or the NHS, in 1948. And Aaron Bevan, the central figure on the slide, has been credited for making it happen. The founding principle was free healthcare for all citizens from cradle to grave. Anyway, around about that time, the birth of the NHS, nearly 50% of the people in the UK did not make it beyond 65. In India, in the early 1950s, the average life expectancy was just 31 years. There have been some amazing advances over the years, both in medicine and public health, which has contributed to this dramatic improvement in life expectancy. The story of penicillin and Alexander Fleming is well known. The photograph below, Fleming, is that of Shankar Balasubramanian, an organic chemist born in Chennai, and his parents moved to the UK. He invented a way of sequencing genomes that was 10 million times faster than was used in the Human Genome Project. It has transformed healthcare. In fact, it was this technique that has been used in COVID-19 pandemic to better understand the virus and its variants. Talking about COVID, that has shone a spotlight on the tremendous abilities of science and medicine. After the initial shaky start when Trump advocating injecting disinfectants and the far safer and palatable suggestion on the internet of hot milk with turmeric or spiced tea with ginger and black pepper, we now in 2 years have managed to produce a number of effective vaccines and numerous drugs which have saved millions of lives. Even with this rapid rise of in life expectancy, I was surprised to read that a third of the babies born in UK in 2013 are expected to live to be 100. Every centenarian in the UK gets a birthday card from the Queen. So whoever's the head of the royal household is at risk of getting writer's cramp when the 2013ers turn 100. India is doing very well. Life expectancy has gone up 5 years in a decade. And in 2019, life expectancy in India was 70 years, a far cry from 31 in 1950, and that line is still going up. Globalization of modern medicine has globalized life expectancy, though unfortunately, there are big differences between countries. The blue zones are the geographic regions where people live longest. And even though they are far apart, there are some common themes that run through these regions. In contrast, I would call these red zones, where humans have the lowest life expectancy. And it's sad that this was a continent where mankind first evolved. So living longer is our one achievement that crowns all others, and we should be celebrating it. There's an interesting article in the Times of India, written on the 60th anniversary of Indian independence, where the author was critical not so much the space given to all that India had achieved in 60 years, but the fact there's barely any mention of the rapid rise in life expectancy, which according to the author should be the country's greatest achievement. I can understand this to some extent, as there does seem to be some despondency and I might say negativity around this whole process of aging. The Western media have not helped exactly, as a phenomenon has been given very negative connotations and likened to a tsunami, tidal wave, time bomb, and somehow even consider the older person a burden to our society. In a similar vein, an article in the Indian Economic Times had the same negative connotations. To quote from this article, the twin challenges of rising population and old age dependence will only add to India's trouble of providing jobs, education, healthcare, along with geriatric care. So it's fair to say that our greatest achievement has led to our greatest challenge. And I suppose what you're struggling with is trying to get the balance between getting life in our years and just not years in our life. I think the older folk are well within their rights to ask us why are we making them live longer if we cannot make them live better. It's a strange situation to be in. On one hand, we seem to be able to perform miracles with modern medicine. On the other, we are at our wits' end when faced with an older person with various problems. I suppose at times we do feel overwhelmed and feel we cannot cope with all the challenges that aging and frailty brings with it, and I have illustrated a few. So, do we shout about this greatest achievement from the rooftops, or do we worry, or how do we change our healthcare systems to deal with this so-called tidal wave, and how to educate society and prepare people to live a long and happy, fulfilled life? I think we all agree that quality of life is important, especially as we get older. In the UK, if someone lives to 65, they can expect to live an additional 18 to 21 years. The question is, what proportion of that time can they expect to have a good quality of life? It's about 56%. So for about 6 to 10 years of someone's life, one can expect to live with all the problems that age brings with it. It's not the same for everyone, and as usual, the poor are disadvantaged. In the UK, individuals born in the most affluent neighborhood would on average expect to experience an additional 17 years of good quality of life compared to the most deprived. That's worrying, and UK is a small country. I'm sure the gap over here is wider still. There's a view that if medicine carries on advancing the way it has, then we may achieve immortality, but it'll come with infinite aging. We have made great strides in dealing with acute death, a really good achievement, but we have converted it to chronic death. So heart attacks have become heart failure. Strokes have become vascular dementia. Now there's an opposing view published in the journal Nature that despite all the advances of science, there still will be always a limit to our lifespan, which will be, they say, about 115 years. So despite an aging population, people like that lady over there celebrating 121st birthday will remain a rarity. But science is advancing rapidly, and recent research from Cambridge counters that view. Scientists have rejuvenated a 53-year-old woman's skin cells so they are like that of a 23-year-old's. And they believe they can do the same with other tissues in the body. And what's important, they've done this without losing the specialized function of the cells. It works like skin cells. The research has given the field of regenerative medicine a huge boost. The specialty is all about repairing or replacing damaged or diseased human cells or tissues and thereby restoring normal function. So watch this space. But for now, we all just have to keep applying good old Vico turmeric vanishing cream. Anyway, people are getting older, and the question is how to make their life better. Geriatric medicine is a subspecialty that's meant to provide some of the answers. It's not the domain of a particular specialty, and as geriatricians, we are most welcoming to all specialties because everyone needs to be able to look after the older person, even surgeons and orthopedicians. The cornerstone of the specialty is to be able to look after a person in a holistic manner, provide comprehensive care. It does set us apart from a specialist where the focus is one organ. The specialty involves looking after both the acute illnesses and chronic illnesses that age brings with it, along with managing the disability that chronic disease causes. We know that half of over 65-year-olds have at least one chronic illness. Multiple problems can involve multiple doctors, which usually means a cupboard full of medicines, and large part of our work is to rationalize the numerous tablets that are prescribed. There's no doubt that sometimes the problems suffered by the older person are iatrogenic or physician-induced, most of it from medication. Then, of course, there are a number of ethical and legal issues which you will struggle with, as the answers are never black or white. There are shades of gray, be it questions around mental capacity, artificial nutrition, withdrawing treatment, and other end-of-life questions. Families are not to be forgotten because, like pediatrics and geriatrics, family and patient are one package. One of the interesting conundrums of getting old is the difference between aging and frailty. They're closely linked, and the terms are often used interchangeably, but they are distinct entities. For one, everyone who's old is not frail. So for the over 85s, 25 to 50% of people over 85 said to be frail. That means 50 to 75% are not. As geriatricians, frailty is what we deal with on a daily basis. So what makes a patient frail, a person frail? For that, we need to know what makes us old. So as we age, we lose cells from our organs, which leads to loss of reserve. And that, to put it very simply, is aging. The reserve is what we depend on in times of need, when we become unwell or put in any stressful situation. Frailty is the same, except that the whole process is accelerated and exaggerated. So a frail person just cannot tolerate any stressful situation. They react very badly to it. For example, become very unwell, even with a minor illness, prone to complications following surgery. They can get confused easily or react badly to change in medications, or lose their muscle strength just after a few days in hospital. It's important to recognize frailty as things can be done to prevent all the problems that befall them. Now, the understanding of geriatrics has evolved over the years, but it has been difficult to communicate to people what geriatrics is. Now, the Canadian American Society of Geriatrics have tried to encapsulate the key problems that older person has to deal with and launched the geriatric 5 M's: mind, mobility, medications, multi-complexity, matters most. I suppose the task of a geriatrician would be simple if the older person only had one of the 5 M's, but it never is. And the person often has 3 or 4 of these problems. And this is illustrated in the next few slides. This is a story of a patient who was referred to our clinic by his general practitioner. And he came along with his daughter. He had a previous stroke from which he made a good recovery. He had diabetes, hypertension, heart failure. After talking to him and his daughter, we noted a number of problems. He was having frequent falls. He was feeling dizzy all the time. He had lost complete confidence. He was a person who could go to town by bus, tend to his garden, and now was just getting about his house, holding onto furniture, what we call furniture walking. He was getting more forgetful, and the daughter said the confusion was far worse early in the morning. He had lost his appetite. He lost weight. He couldn't sleep because he was running to the toilet all the time to pass urine. In fact, some of the falls was due to him dashing the toilet. His daughter said that his neighbors were complaining that they knew which TV program he was watching because the TV was so loud he was getting deaf. His wife had passed away 2 years ago, just before COVID hit, and he had stopped going out, little contact with the family. He's under the care of a cardiologist, a stroke physician, and a diabetologist. The GP who referred him to us mentioned that his diabetes is well controlled, his blood pressure is very well controlled. He was on 10 different tablets. Last but not the least, his main carer, who was a doctor, was very stressed. She was holding back her tears when the father was there. As soon as the father left the room, she broke down because the father she knew had gone. So, where do we start? And I tend to ask 2 questions to try and what I call demedicalize the situation. It's very easy to think that because all the problems seem medical, the solutions lie in medicine, and without realizing it, we have medicalized the patient. The question I ask is, what is your main problem? To give some control back to the patient, and what is it that you would like to get back to doing when you get well? When I asked him what's his main problem, he said, I just feel lifeless. To my second question, he said that he would like to tend to his garden and go by bus to town. Now, the gold standard of managing a patient like Mr. AB is called Comprehensive Geriatric Assessment, or CGA. It's an assessment and diagnostic process which involves different professionals, it's multi-professional. So we have the physiotherapist who will assess his gait and balance, look at muscle strength, see the person needs a walking aid, how does he do on the stairs. The social worker will look to see whether the person needs any help at home. We have the occupational therapist who will see how does the person get up in the morning, wash and dress, get down for breakfast. We have the doctor looking at the medical problems along with the pharmacist looking at the medicines. The nurse assessing his mood, his cognition, his mental state, talking to the family, finding out how they are coping. We then develop a problem list and a care plan, and we intervene at things at which we can try and correct. And after that, we follow the patient up to see if any of it has worked. Now, this is very resource intensive, it's expensive. But if it is done well, then yes, it works because it keeps people alive, it keeps them at home, and it prevents them going into hospital. And there's good evidence for this. So let's go back to Mr. AB. So after we examined him, we took some blood tests, took a proper history, etc. We actually found that good BP control the GP said he had was actually too good because his blood pressure was dropping like a stone the moment he stood up. That's the reason for his dizziness. His heart rate was too slow. Again, the reason for his dizziness. His prostate was enlarged. That's why he was going to the toilet up and down. The blood sugar, which the GP said was really well controlled, was actually too well controlled because blood sugar was dropping at night and he was getting more confused early in the morning. His vitamin D is very low. He was very hard of hearing, as we know. He had a lot of weakness in the muscles, what we call sarcopenia. The nerves in his feet weren't working because of diabetes. He had poor fluid and diet intake. He had difficulty cooking. He had lost weight, so dentures had become loose, so he couldn't eat properly. He had difficulty with stairs. He had trip hazards all over the house. There were wires in the house. Carpets weren't taped down. He was depressed, and there were issues about his memory. So what do we do then? Well, we stopped a lot of his tablets, his blood pressure tablets, his heart rate, his diabetes. We gave him vitamin D, we treated his prostate. Worried about his bones, so we did a scan to look for osteoporosis. We advised him and his daughter about getting the enduring power of attorney. We asked him to increase the fluid intake so his blood pressure would go up. We organized ready meals so he didn't have to cook for himself. got a hearing test done, aids and adaptations were given to the house, he was given exercise to do at home, and he was invited to a falls prevention program in our day unit, and also advised about Tai Chi, which has got good evidence for strength and balance. We referred him to a charity called Age UK, which gives good advice to patients and their family. We then followed him up after a few months and to see how he was. Well, I would say we were partially successful because he said he's feeling better. He had more life in him. The dizziness had not gone, but was better. He could stand without falling. His pulses improved. His blood sugar was better, and the doctor said that confusion he's getting in the morning had disappeared. He was going into his garden, but not to town. He had a hearing aid, but he wasn't wearing it, like a lot of older folk. He hadn't fallen. He was attending a falls program. He was not interested in Tai Chi, he said. His mood was low, but better. He was enjoying his food, weight was up, and most important, daughter was happy. The daughter is happy, we are happy. Now, I mentioned the importance of medicines, as they're both a boon and a curse for the older person. Now, I've had a wife hand me her husband's prescription, telling me it's hers, and I'm wondering, why is this lady taking tablets for an enlarged prostate? I often remember my father when I go to a patient's house and see drawers full of medicines. Now, these were lines that he would often quote, and I'm sure Oliver Wendell Holmes is shaking his finger and saying, "I told you so," when he said if all the medicines in the world were thrown into the sea, it would be bad for the fish and good for humanity. Anyway, I don't think we need medicines, and we seem to be doing a perfectly good job decimating the fish with plastic. Now, final point on medicines. The title of this slide says it all. The question asked was, why are the older people excluded from taking part in clinical research? The authors looking at research trials over 10 years of common conditions like diabetes, heart failure, dementia, cancer, they found that very few older and frail people were included in the trials. So we are using medicines on older, frail patients that have been proven to work on younger people, but with little understanding of how these medicines affect the older person. Now, this is a quick summary of what older person needs: exercise, nutrition, mind, and medicine. Let's focus on the fifth M, that matters most, the mind. I think that is really important. It's great to get your daily fix of Sudoku, Wordle, crosswords, but what is shown to be more effective are relationships, strong social ties, connections, interaction with society, a sense of self-worth, a sense of usefulness. My mother does a Sudoku, but despite a bad back and the loss of a life partner, she's out playing mahjong, or teaching women how to smoke, or contacting different unsuspecting people to rehome homeless dogs, or meeting with a garden group of friends called Birds and Bees. They're meant to be having a highly intellectual discussion about plants, but I think it's more about who can serve up the best lunch, and of course discussing the gossip of the town. Over years, she's had a few unsuccessful attempts at becoming businesswoman of the year, but I think this time she's on to a winner. She makes a range of Nana's products to sell at the local shops. She's very much head of the family, takes a keen interest in her grandchildren and great-grandchild, and tells her children off as she did 50 years ago. So this is a fifth M. This is what matters most to her, to get up in the morning and make the best use of the day ahead. By the way, the dog in the picture is not homeless. In fact, it owns the home. None of us have any chance of relaxing on that recliner. Now, the art of geriatric medicine is how do you demedicalize the patient? On one hand, how do you treat them with all that medicine has to offer? And on the other, how do you take medicine out of them? At what point do we move from making people live longer to making people live better? How do you find the fifth M? What matters most? The Japanese call it ikigai. It's about finding the purpose in our life. And this book is a very interesting read about the lives of people in Okinawa, an island in Japan. It has the most centenarians in the world. I think we all have an ikigai deep within us, and some of us have found it, others are still looking. It's not easy, unlike a person in a white coat, or a hospital full of machines, or a pharmacy full of medicines. This is something we cannot touch, feel, or we cannot see. This is something that we have to do for ourselves, and often overcoming a lot of physical and mental sort of pain. I better wind down now. I think as far as medicine goes, we'll be doing really well, motoring down this highway of life. But as far as the older person goes, I think we've come to a crossroad and need to give some thought of how we go forward. Atul Gawande has written a nice book called Being Mortal. It's worth a read. It's a bit repetitive, but he articulates quite well a lot of issues we struggle with. I'd like to share a few lines with you. He says, people live longer and better than any other times in history, but scientific advances have turned the processes of aging and dying into medical experiences, matters to be managed by healthcare professionals, and we in the medical world have proved alarmingly unprepared for it. There's no doubt that we are unprepared for frailty and aging. Just like medicine has made a big contribution to the process of aging, the older generation made an even bigger contribution to medicine, and that is they made us question our current strategy and practice. They've jolted us out of our sense of complacency and reminded us there is much more to looking after the older person than all the bells and whistles of modern medicine. I'll end by sharing something from my past. This is a painting by Luke Files, painted in 1887, 10 years after his son died of TB. He was very impressed by the empathy and kindness shown by the doctor. So when Sir Henry Tate commissioned to create a painting that reflected social realism of that time, he did this. It shows a sick child, probably suffering from pneumonia, in a very poor house. There's no bed, 2 chairs strung together. In the background is a mother slumped exhausted, the father looking anxiously on. The central figure is a doctor, sitting by the bedside, probably waiting for the fever to break, which will determine if the child lives or dies. It was a pre-antibiotic era. The only drug available that did not kill was aspirin. So there's nothing much more he could have done. He was probably sitting there a while, providing a sense of calm, hope, and assurance to what was a desperately serious situation. This created quite an impression when it was first shown, and it has been used frequently through the ages to reflect a point of view of medicine and medical care. And for some reason, that doctor sitting there is meant to embody all that is good about medicine. Now, I did not realize how well known this painting was till I went to the UK, as I saw it hanging in a number of places. A print has been hanging in our house ever since I can remember. I gave it scant notice when I was growing up, but just before I joined medical college, my father took me aside and showed me the painting and said, "Have a look and take what you can from it and you will be okay." With this cryptic bit of advice, he sent me on my way. This, by the way, is in stark contrast to what I told my daughter when she joined medical school. I said, "Study hard and do not waste your time." In a little over 100 years, we have gone from having practically no decent, safe medical treatment to this. We have made the most incredible advances in a very short space of time. But the speed of progress, I think, has been so rapid that without realizing it, we have left certain values behind. And thinking back, the advice my father gave me was probably not that cryptic after all. Thank you.
Thank you, sir. Thank you for a wonderful speech. I invite Dr. D.M. Vasudevan, Research Director, Jubilee Center for Medical Research, to conclude the session.
My dear colleagues, it is an honor and privilege to participate in this historic occasion of Dr. Adenwalla Memorial Oration. I'm going back about 40 to 50 years back. I did my MBBS from Calicut Medical College, and that was I finished MBBS in 1967. 1968, I was doing my house surgency, and casually talking with many patients and relatives, I came across the Jubilee Medical Mission Hospital at Trichure, because the transportation was not that easy at that time. Trichure was very far away from our mindset at that time. Anyway, whenever somebody talks with the Jubilee Medical Mission, immediately they will talk about Dr. Adenwalla. It was something like a symbiosis, great symbiosis between the hospital and the doctor. And it is very fascinating to see that the hospital grows, the doctor grows. And of course, the hospital has grown out. But it is very satisfying to see that a committed doctor, a doctor with a passion, a missionary hospital and a missionary doctor had a symbiosis. And many years after I could see him personally, but historically, it is a great legendary figure that he was. And certainly, as you have told that he has done more than 23,000 cleft surgeries, etc. But in a nutshell, I cannot go further, and my pranams at the memories of this great, illustrious, and legendary figure. And also a special mention has to be given here at the moment when to the authorities of Jubilee Mission Hospital that they have made this oration and so that the memory of a great personality will be continued. And today's oration was done by Dr. Firdaus, and I am sure he is the committed son of a great father. An eminent person, he is an eminent person in his own right, and he has made some glimpses of the problems of geriatrics. As all of us know, the life expectancy all over the world has been increased, including in India. And the importance of comprehensive geriatric assessment he has mentioned. And also he has given some light on how to make the person feeling better in the geriatric care. We were always told that in the old age, there is a tendency for falling. There are many reasons for that. And I know that there was an ICMR grant for us in this institution for prevention of falls in the aged persons. It is said that 33% of the people in the geriatric age will get a fall at least once in a life. And it is also said out of this 33%, that is 33% is falling, out of that 1/3 will again get a fall within 1 year. That means that the prevention of the fall is not proper. And it is our duty that we should take more care for this geriatric population that is going on increasing. And marvelous oration. We heard a marvelous oration, a wonderful oration, and certainly useful, not only for the elderly people, but all the human beings. And that is a great event that we had undergone. Finally, when the organizers called me to sum up this particular topic, I was wondering why I was chosen. Because my topics were something else. Then I found out that I am an apt person because I am an octogenarian. And I do hope I will not fall down. Thank you.
Thank you, sir. With this, the oration programs comes to the end. Next, we have the award ceremony. I request everyone to be with us as we will begin the session soon. I request the students to be seated. We'll begin the program soon. Welcome to Monsignor Mathew Muringathery Memorial Award Ceremony 2022. This is a proud occasion for Jubilee as we announce the Monsignor Mathew Muringathery Memorial Award instituted in honor of the founder director of this institute. Welcome to. We'll begin the program. I request the dignitaries to kindly come to the stage. His Grace Ma Jacob Tumburi, Reverend Father Rennie Mundangurian, Mrs. Susanna Sharaf, Shri Risharaj Singh IPS, Madam Mamta Carroll, Mrs. Gurnal Adenwalla, Dr. Benny Joseph, and Dr. P.C. Gilvas. We'll begin the program by invoking the blessings of the Lord. Madam Tara Kumaravelu will lead us in prayer.
O glorious, eternal, ancient one, your face is a bright, transcendental sun. Lighten this dark world and the tears I weep. My heart meher I give to you to keep. Creator, yet creationless you are. Truth and truth's body, divine avatar, who through compassion the three worlds maintains. Destroy this ignorance that life sustains. These five lights are the whirling spokes of breath of the world's wheel that bears me unto death. Unless you who are infinitely kind break the wheel's hub which is conditioned mind. This incense is my love, these fruits my art, which to please you I have shaped from my heart. Accept them as you would a simple flower that has no use beyond its shining garb. You are myself, I sing to you in praise, and beg your love to bear me through the days, till you, the ever-living perfect one, illume my darkness with your shining sun.
Thank you. Father Rennie Mundangurian, the director of Jubilee Mission Medical College and Research Institute, will welcome the gathering.
A very pleasant good afternoon to one and all of you. It's my pleasure to have you all here with us. Today marks one of the most important and proud moments for Jubilee. The 70 years of Jubilee, and Jubilee celebrates its or her Jubilee this year. We have organized so many programs this year with the community responsibilities. And this year, we cannot celebrate our Jubilee without remembering two great pillars of Jubilee. Today, Jubilee announces and presents the first Monsignor Mathew Muringathery Memorial National Level Healthcare Missionary Award to promote missionary zeal in the current healthcare scenario in the country. Today is the second day of one program called Pelekanos 2022. Yesterday was the first day. Very touching and deep experiential day was yesterday. The get-together of the cleft lip patients. They were not patients, they are cured patients, cleft lip. It was very, very touching. And yesterday also somebody asked what is Pelekanos. Today also I got the question, why this name? Pelekanos. Only one word. Pelekanos is the Latin word for pelican, the bird, the legendary bird. She cut her breast and took blood to give nourishment to her children when there was no food and water, when there was drought. And she is considered as the universal symbol of great sacrifice and charity, pure sacrifice. We took this name to present two of our pillars of the Jubilee. Monsignor Mathew Muringathery, our founder director, and Dr. Adenwalla, 60 years of service to the Jubilee. We cannot celebrate 70 years of Jubilee without remembering these two persons. So we started the oration this year in memory of our dear, respected Dr. Adenwalla. It was a great experience for also to meet his family and also the acquaintance with Dr. Adenwalla. So today in this program, my duty is to welcome all of you to this simple but very touching program. We all are sitting here with memories of two legends. Today, first program was the oration. The second is the award in memory of Monsignor Mathew Muringathery. And there are some small but very important programs we have planned. We have dedicated some facilities, 2 buildings to these legends that will be announced. 2 buildings will be named after Dr. Adenwalla and Monsignor Muringathery. And Cleft Lip and Palate Institute will be named after Dr. Adenwalla. And we are starting a special charity fund for the pediatrics, especially children from the poor family, especially neonatal babies. It's a very dire need in our hospital. Premature babies, sometimes they have to remain 2-3 months in the incubator, mostly are coming from the poor family and difficult to find to pay the bills. So we are starting a poor fund for the pediatrics. And we also start a Smile Train Fellowship from this year onwards. These are the main programs we are going to do. 5 or 6 programs, but it will be finished very soon. In this, our family program, I would like to invite all your attention to the stage. It's very simple but respected guest of our Jubilee family. I'm delighted to welcome our father, His Grace Mathew Muringathery. He is the founder patron of the Jubilee Medical College, 2003. It was his desire to bring Jubilee to the next level. With his decision, with the help of Father Alapat, it was realized. I am really honored to welcome him. He also ordained me. He gave his blessings to me when I became priest. So, with your permission, with your love, I welcome our Father, His Grace, Mathew Muringathery, in our middle. And I'm delighted to welcome Mrs. Susanna Schaefer, President and CEO of Smile Train organization from New York. As we already heard, it is this organization helped Dr. Adenwalla to do the cleft lip operations free of cost. They are helping us. A long-term partnership is there from 2000 onwards. She took time, pain to come here to attend this meeting. Dear Mrs. Susanna, hearty welcome in our middle. Today, in all papers, there is a good coverage, write-ups about yesterday's program. You might have read. The middle of the news, one name was there. It was our respected Hirji Raj Singh, the former DGP of Kerala IPS. It was really touching, his experience sharing yesterday and motivating the cleft lip patients. I am one among you. That was his word. He's very well famous in Kerala because of his straightforwardness and sincereness. So I'm happy to welcome our beloved Hirji Raj Singh in our middle. And I am happy to welcome Ms. Mamata Carroll, Senior Vice President and Regional Director of Smile Train. The entire team is there of the Smile Train organization. They told us they are part of Jubilee family now. So they came alone up. They need not, they told they don't want any guide to come here. They know the way now. They came here alone. And Mama Carol is after him dies. So in the name of Jubilee family, I welcome whole Smile Train family and especially our Mama Carol. Hearty welcome, madam. As in the beginning, as Father Devin told, there are three families: Jubilee family, Smile Train family, and family of Dr. Adenwalla. They are also part of Jubilee family for 60 years, but they are here to attend especially today's program. So I welcome the whole family of Dr. Adenwalla, especially his wife, Gulnar Auntie, in our middle. Hearty welcome, Auntie. The rest too are the Jubilee family members, our CEO, Benisa, and our medical superintendent, Gilwa sir. They are part of our family. They need not welcome them, but as an official mark of courtesy, I welcome Benisa and Gilwa sir in our middle. ഇനി രണ്ട് വാക്ക് മലയാളത്തിൽ പറയാം എനിക്ക് തോന്നുന്നു. കാരണം അഡൻവാല സാറിൻ്റെ കൂടെ ഉണ്ടായിരുന്നവരെ, മുരിങ്ങാത്തേരിച്ചൻ്റെ കൂടെ ഉണ്ടായിരുന്ന കുറേ പേര് ഇവിടെ എത്തിയിട്ടുണ്ട്. വളരെയധികം, വളരെ സന്തോഷം. എൻ്റെ കയ്യിൽ ലിസ്റ്റ് ഞങ്ങൾ എടുത്തിട്ടുണ്ട് വന്നവരുടെ മുഴുവൻ. ഞാനിത് മുഴുവൻ വായിക്കുന്നില്ല. ഒരു 24 സിസ്റ്റേഴ്സിൻ്റെ പേര് എഴുതിയിട്ടുണ്ട്. വളരെ സന്തോഷമുണ്ട്. അവർ ബുദ്ധിമുട്ടിയിട്ടാണ് വന്നിരിക്കുന്നത്. എഡൻവാല സാറുള്ള, മുരിങ്ങാത്തേരിച്ചനുള്ള താല്പര്യം കൊണ്ടാണ് അവർ വന്നിരിക്കുന്നത്. അന്ന് കൂടെ ജോലി ചെയ്തിരുന്ന ചേച്ചിമാരുണ്ട്, ചേട്ടന്മാർ 1-2 പേരുണ്ട്. അങ്ങനെ ഒരു കമ്മ്യൂണിറ്റിയും ഇതിന് ഇടയിൽ ഉണ്ട്. അതുകൊണ്ട് നമ്മുടെ പഴയകാല സുഹൃത്തുക്കൾ, എടംവാല സാറിൻ്റെ ഇടം കൈയും വലം കൈയും ആയിരുന്നവരൊക്കെ ഡോക്ടേഴ്സും എത്തിയിട്ടുണ്ട്. വളരെ സന്തോഷം. റിയലി സ്പീക്കിംഗ്, ഇറ്റ് ഈസ് ഹാർട്ട് ടച്ചിങ് ടുഡേ. യുവർ പ്രസൻസ്. ഹാർട്ടി വെൽക്കം ടു യു all. Thank you very much.
Thank you, Father. With great respect and love, let me invite His Grace Mark Jacob Thumburi, the Archbishop Emeritus of Thrissur, to deliver the presidential address. His Grace was the Metropolitan Archbishop of Syro-Malabar Catholic Archdiocese of Thrissur from 1997 to 2007 and the founder patron of Jubilee Mission Medical College and Research Institute.
Dear and respected members of the family of Monsignor Mathew Muringathery and Dr. Adenwalla, distinguished people here on the dais, but dear brothers and sisters. Jubilee Mission Hospital തുടങ്ങിയിട്ട് 70 വർഷമാകുകയാണ്. അപ്പോൾ 7 വർഷത്തിൻ്റെ ഒരു ചെറിയ ജൂബിലിയാണ്. So today is the Jubilee of Jubilee Mission. I'm so happy that this is being celebrated so beautifully. നമ്മുടെ ഈ മിഷൻ ഹോസ്പിറ്റൽ തുടങ്ങിയത് ഒരു ചെറിയ ഡിസ്പെൻസറി ആയിട്ടാണ്. ഗവൺമെൻറ്റിനല്ലാത്ത നോൺ ഗവൺമെൻറ്റൽ ഡിസ്പെൻസറി. ഇതിൻ്റെ പ്രത്യേകത എന്താണെന്ന് ചോദിച്ചാൽ ഇതിൻ്റെ മോട്ടോ ആണ്. ഇതിൻ്റെ ഇൻസ്പിറേഷൻ എവിടെ നിന്നാണെന്നുള്ളതാണ്. ഇതിൻ്റെ ഇൻസ്പിറേഷൻ ഇതാണ്: സെർവ് വിത്ത് ലവ്, സ്നേഹത്തിൽ അധിഷ്ഠിതമായ സേവനം. ഈ മോട്ടോ അനുസരിച്ചാണ് മോൺസിഞ്ഞോർ മാത്യു മുരിങ്ങാഥേരി ഇത് ആരംഭിച്ചതും തുറന്നുകൊണ്ട് പോയതും. അദ്ദേഹം 34 വർഷം ഈ ആശുപത്രി ഉണ്ടായിരുന്നു ഡയറക്ടറായിട്ട്. എൻ്റെ ചെറുപ്പകാലത്ത് ഞാൻ മാനന്തവാടിയിൽ ബിഷപ്പായിരുന്ന കാലത്ത് മാത്യു മുരിങ്ങാഥേരി ഇവിടെ വന്ന് കണ്ടിട്ടുണ്ട്, ഹോസ്പിറ്റൽ സന്ദർശിച്ചിട്ടുണ്ട്. വളരെ വിനീതനായ, വിശുദ്ധനായ, സേവന സന്നദ്ധതയുള്ള, നിശബ്ദനായ ഒരു നല്ല മിഷണറിയായിട്ടും ഡയറക്ടറായിട്ടും ഞാൻ അദ്ദേഹത്തെ പരിചയപ്പെടുത്തി ഓർക്കുന്നു. അദ്ദേഹമാണ് ഇതിൻ്റെ ഈ ആശുപത്രി ട്രെൻഡ് തീരുമാനിച്ചത്. നമ്മളെങ്ങനെ മുന്നോട്ട് പോകണം. ഇത് പാവങ്ങളുടെ ആശുപത്രിയാണ് അറിയപ്പെടുന്നതും പാവങ്ങളുടെ ആശുപത്രി. പക്ഷെ ചിലപ്പോൾ പാവങ്ങൾ വരുമ്പോൾ പൈസ കൊടുക്കാതെ ചികിത്സിക്കാൻ പറ്റില്ലെന്ന് പറഞ്ഞാൽ എന്നാൽ അവരെ തിരിച്ചുവിട്ടേക്കാം എന്നൊരിക്കലും മോൺസിഞ്ഞോർ മാത്യു വിചാരിച്ചിരുന്നില്ല. അവരെ തിരിച്ചുവിടരുത്, എങ്ങനെയെങ്കിലും ചികിത്സിച്ചു വിടണം എന്നുള്ള നിർബന്ധം അദ്ദേഹത്തിനുണ്ടായിരുന്നു. അങ്ങനെ നമ്മുടെ ഈ ആശുപത്രിക്ക് വളരെ സുന്ദരമായൊരു പേര് കിട്ടിയിട്ടുണ്ട്. മോൺസിഞ്ഞോർ മുരിങ്ങാഥേരി ഈസ് ഹോസ്പിറ്റൽ ആരംഭിച്ചു, വളർത്തി. ഇന്ന് നമ്മൾ അദ്ദേഹത്തെ തീർച്ചയായിട്ടും ബഹുമാനിക്കുമ്പോൾ ഏറ്റവും അർഹമായൊരു ബഹുമതിയാണ് അദ്ദേഹത്തിന് കൊടുക്കുന്നുള്ളതിന് യാതൊരു സംശയവുമില്ല. രണ്ടാമതായിട്ട് പ്രഗത്ഭനായ ഈ ആശുപത്രിയിലെ ഏറ്റവും പ്രഗത്ഭനായ മനുഷ്യൻ ഡോക്ടർ ഏഡൻവാലയാണ്. അദ്ദേഹം 60 വർഷത്തോളം നമ്മുടെ ആശുപത്രിയിൽ ജോലി ചെയ്തു. അദ്ദേഹത്തിൻ്റെ അദ്ദേഹത്തെ കൊണ്ടുവന്ന കഥയൊക്കെ കേട്ടിട്ടുണ്ട്. മുരിങ്ങാത്തിരി അച്ഛൻ ബോംബെയിൽ ചെന്ന് അദ്ദേഹത്തെ കണ്ടുപിടിച്ചു, ഇഷ്ടപ്പെട്ടു. അദ്ദേഹം ആഫ്രിക്കൻ മിഷന് പോകാനായിട്ട് ഒരുങ്ങിയിരിക്കുകയായിരുന്നു പറഞ്ഞത്. ആഫ്രിക്കൻ മിഷന് പോകണോ അത് ജൂബിലി മിഷൻ ഹോസ്പിറ്റലിൽ പോകണമോ എന്നുള്ള ആ പ്രശ്നം വന്നപ്പോൾ നമ്മുടെ മുരുകേശ്വരി അച്ഛൻ ബോംബെയിലെ ബിഷപ്പിനെയൊക്കെ കണ്ടു. അങ്ങനെ ശുപാർശയൊക്കെ ചെയ്തു നോക്കുകയും വളരെ സൗഭാഗ്യപ്രദമായ വിധത്തിലാണ് നമ്മുടെ ഡോക്ടർ എഡൻവല ഇങ്ങോട്ട് കൊണ്ടുവന്നത്. ഇവിടെ വന്ന് അദ്ദേഹം 60 കൊല്ലത്തോളം ഇവിടെ നമുക്ക് സേവനം ചെയ്തു. അദ്ദേഹത്തിൻ്റെ പ്രത്യേകത നമുക്കെല്ലാവർക്കും അറിയാവുന്നതുപോലെ മുറിച്ചുണ്ട്, മുറി അണ്ണാക്ക്, ക്ലെഫ്റ്റ് ലിപ്പ് ഓപ്പറേഷൻസ് ആയിരുന്നു. ഇവിടെ നേരത്തെ പറഞ്ഞതുപോലെ 23,000 ഓപ്പറേഷൻ. ദൈവം മനുഷ്യനെ സൃഷ്ടിച്ചപ്പോൾ എല്ലാവരുടെയും ഉള്ളിൽ മുഖത്ത് പുഞ്ചിരി ഒളിച്ചു വെച്ചിരുന്നു. പക്ഷേ ക്ലെഫ്റ്റ് ലിപ്സുമായിട്ട് വന്നവർക്ക് അത് ആ പുഞ്ചിരി ഒളിഞ്ഞു തന്നെയിരുന്നു. അത് പിന്നെ ആരാ പുറത്തെടുത്തത്? ആ പുഞ്ചിരി പുറത്തെടുത്തത് എഡൻവലയാണ്. എനിക്ക് 90 വയസ്സ് തികഞ്ഞ അവസരത്തിൽ ഒരു ക്ലാരിസ് സിസ്റ്റർ അനിത 90 റോസപ്പൂക്കൾ ഉണ്ടായിക്കൊണ്ട് എൻ്റെ അടുത്ത് വന്നു. എൻ്റെ മുറി അലങ്കരിച്ചു. എല്ലാവരും പറഞ്ഞു എന്ത് സുന്ദരമായ റോസപ്പൂ, മുറിക്കതൊരു അലങ്കാരമായെന്നൊക്കെ പറഞ്ഞു. അത് ശരിയായിരുന്നു. അപ്പോൾ ഞാൻ ഓർക്കുകയാണ്, നമ്മുടെ ഡോക്ടർ എഡൻവല അതിൻ്റെ സ്വർഗത്തിലെ വസതിയിൽ ആ വസതി സുന്ദരമാക്കുവാനായിട്ട് 90 റോസപ്പൂക്കളല്ല 23,000 ക്ലെഫ്റ്റ് ലിപ്സ് സുഖപ്പെട്ട ആളുകളാണ് ചുറ്റുമിരിക്കാൻ പോകുന്നത് ഞാൻ വിചാരിച്ചു. അങ്ങനെ അദ്ദേഹത്തിൻ്റെ ജീവിതവും മരണാനന്തര ജീവിതം ഒക്കെ ഏറ്റവും സുന്ദരമായി തീരുകയാണെന്ന് ഞാൻ വിചാരിക്കുന്നു. ഞാൻ കോഴിക്കോട് രൂപതയിലെ പട്രോണി പിതാവിനെക്കുറിച്ച് തമാശ പറഞ്ഞ് കേട്ടിട്ടുണ്ട്. ഇറ്റാലിക്കാരനാണ് അദ്ദേഹം. ഇവിടെ വന്നും ശരിക്കും മലയാളം പഠിച്ചു. എങ്കിലും ഉച്ചാരണത്തിന് കുറച്ച് പ്രയാസമുണ്ട്. അപ്പോൾ അച്ഛന്മാരൊക്കെ പറഞ്ഞ് തമാശ പറഞ്ഞ് കേട്ടിട്ടുണ്ട്. സ്വർഗസ്ഥനായ പിതാവ് എപ്പോഴാണ് ചിരിക്കുന്നറിയാമോ? അവർ പറഞ്ഞു പത്രോണി പിതാവ് മലയാളം പറയുമ്പോഴാണ് സ്വർഗസ്ഥനായ പിതാവ് ചിരിക്കുന്നത്. എപ്പോഴാണ് ദൈവം പുഞ്ചിരിക്കുന്നത് എന്ന് ചോദിച്ചാൽ ഡോക്ടർ എഡൻവല മുറിച്ചുണ്ടിന് ഓപ്പറേഷൻ ചെയ്ത് സുഖപ്പെടുത്തി കഴിയുമ്പോഴാണ്. അപ്പോൾ സ്വർഗത്തിലെ പിതാവ് ചിരിക്കുകയല്ല, പുഞ്ചിരിക്കുന്നു. അങ്ങനെ കഥകളൊക്കെ ഉണ്ട്. നമുക്ക് ഇപ്പോൾ ഈ 2 പ്രശസ്ത വ്യക്തികളെ നമ്മൾ ആദരിക്കാൻ ആഗ്രഹിക്കുന്നു, അവാർഡ് കൊടുക്കാൻ ആഗ്രഹിക്കുന്നു. ആശുപത്രിക്കെല്ലാം നന്മ നേരാൻ ആഗ്രഹിക്കുന്നു. നിങ്ങൾക്കെല്ലാവർക്കും ഞാൻ നന്മ നേരുകയാണ്. നമ്മുടെ ആശുപത്രിയെ സംബന്ധിച്ച് ഒത്തിരി പ്രതീക്ഷകളോടുകൂടിയാണ് നമ്മളൊക്കെ മുന്നോട്ട് പോകുന്നത്. എനിക്ക് ഒത്തിരി പ്രതീക്ഷയുണ്ട്. നന്നായിട്ട് പോകുന്ന കാണുന്ന സന്തോഷമുണ്ട്. അപ്പോൾ ഞാൻ ഇതിൻ്റെ ഭാര്യ റേണി മുണ്ടൻകുര്യൻ അച്ഛനും അദ്ദേഹത്തിൻ്റെ സഹപ്രവർത്തകർക്കും ഞങ്ങൾക്ക് എല്ലാവർക്കും നന്മ നേരുന്നതുകൊണ്ടും മാത്യു മുരിങ്ങാഥെരി അച്ഛനെയും അച്ഛൻ്റെ കുടുംബത്തെയും അതുപോലെ ഡോക്ടർ എഡൻവലയെയും അദ്ദേഹത്തിൻ്റെ സ്നേഹമുള്ള കുടുംബാംഗങ്ങളെയും സന്തോഷത്തോടെ അനുസ്മരിക്കുകയും അവരുടെ പേരിൽ മെമ്മോറിയൽ സ്ഥാപിക്കുന്നതിനുള്ള സന്തോഷം അറിയിക്കുകയും ചെയ്തുകൊണ്ട് എല്ലാവർക്കും നന്മ നേർന്നുകൊണ്ട് എൻ്റെ കൊച്ചുമക്കൾ അവസാനിപ്പിക്കുന്നു. നന്ദി, നമസ്കാരം.
Thank you, His Grace. Now we have the highlight of the day, the Monsignor Mathew Muringathery Memorial National Level Healthcare Missionary Award presentation. Dr. Benny Joseph, our CEO, will brief you about the award. Over to you, sir.
A pleasant good afternoon to all. Our beloved president of the function and the young member of Jubilee family, 90-year-old young person, His Grace Mar Jacob Tunguri, keynote speaker Ms. Susie, Shri Rishiraj Singh, Mrs. Gulnar, our beloved director, Father Renny Mundankurian, Dr. Gilwas, His Excellency Bishop Sebastian, Bishop from Malaysia, team from Smile Train, especially Ms. Mamta Carroll, our former doctors, Dr. Sunny George, Dr. Menon, with great respect, Mrs. Vergis Paul, Ms. Treasure, our sisters who have worked and toiled their life in Jubilee, members of Dr. Adenwalla's family, Dr. Firdos, Mrs. Humay, Mr. Kumaravelu, Mr. Verghese, Ms. Tara, and the youngest member, Dia, Dr. Subramania Iyer, Dr. Ramkumar, Dr. Desai, and many other old members of Jubilee family and current members of Jubilee family, distinguished guests, and my dear friends. It is my pleasure and privilege to talk about the purpose and the context of giving this national level Monsignor Mathew Muringathery Healthcare Missionary Award. As the president of the function, His Grace Marandrus Tharat, and Father Director spoke, he was a man who dedicated his entire life in healthcare mission. As in the Gospel of John, chapter 13, verses 15 to 16 says, I have set you an example that you should do as I have done for you. For the past 70 years, Jubilee has been in the footsteps of Monsignor Mathew Muringathery. As Luke chapter 9 verses 2 says, we aim to walk in the footsteps of the great healer, the Lord Jesus Christ, who sent his disciples to preach the gospel and heal the sick. That entitles the mission of Jubilee during the last 70 years. The context of this award is not only to recognize and pay a tribute to Monsignor Mathew Muringathery, but also to promote the missionary spirit in national healthcare scenario. It is fitting and proper to talk about two important contexts where we need to focus on missionary healthcare scenario. Over the years, if you analyze, the missionary institutions in healthcare are started closing down one after another. Maybe because of affordability or because of the challenge in keeping the spirit along their mission. Another context, more and more hospitals are mushrooming, which may not look at the ethical dimensions of modern healthcare practices. It was in this context that Jubilee Mission Medical College and Research Institute decided to constitute this prestigious Monsignor Mathew Muringathery National Level Healthcare Missionary Award. We constituted a committee to evaluate various nominations, and finally we decided to give this award to a true missionary in healthcare profession. This annual award is intended to be given to any healthcare professional, be it a doctor, a nurse, an attendant, to anybody who is involved in the healthcare scenario. With these deep sentiments, I would request His Grace Mar Jacob Thungudi to announce the first Monsignor Mathew Muringathery National Level Healthcare Missionary Award.
I have great pleasure in announcing the inaugural Monsignor Mathew Muringathery Memorial National Level Healthcare Missionary Award 2022, instituted in honor of the founder director of Jubilee Mission Hospital to Dr. H.S. Adenwalla. Smile Maker and Guardian Angel for children with cleft lip and palate anomalies.
And the award goes to Dr. H.S. Adenwalla, the Smile Maker and Guardian Angel for children with cleft lip and palate anomalies. Let's put our hands together. Dr. Benny Joseph will continue with a brief sketch of the awardee.
I'm extremely delighted to introduce Dr. Hirji Adenwalla. The day is short and the work is long. The reward is great and the master praises. It is not incumbent on thee to finish the task, but thou must not therefore cease from it. This was a quote often used by Dr. Adenwalla in his speeches. That seemed to be a guiding principle of his, and he never ceased from his efforts at attempting perfection in all that he did. He was born on June 5th, 1930 at Ahmednagar, Maharashtra. He completed his professional education, MBBS and MS from Bombay. He was a senior registrar at Bhai Jarbai Wadia Hospital, where he trained in pediatric surgery from doctors Arthur Desa, Katrak and Rastam Irani, and in plastic surgery from Dr. Charles Pinto. Following his training, he decided to work with Dr. Albert Schessner in Africa as a medical missionary. However, the family was against going him and settling in Africa with a 17-year-old girl, Gulnar, with whom he was deeply in love and wanted to marry. Hence, he embarked on a career in Thrissur at Jubilee Mission Hospital in 1959. Jubilee Mission was a small dispensary at that time. Through his dynamic, all-round surgical mettle, this center developed into a major hospital catering especially to the poor masses. He was fondly called the Dr. Sahib by the local population in view of his appearance. For the last 40 years of his life, he restricted his work to the wholesome treatment of cleft lip and palate children who came from the breadth and length of our country, starting from Jammu Kashmir to Kanyakumari. His surgical prowess was appreciated by Ralph Millard, who mentioned his work in Volume 1 and Volume 3 of his path-breaking masterpiece, Cleft Craft. While his surgical skills were of the highest caliber, his human personality left an indelible memory in every person with him he acquainted. He was a multifaceted personality. As one of the greatest orators ever, he mesmerized audiences at conferences. As a teacher, he enthralled his trainees through his teachings, especially during operating sessions. As a team leader, he took the Charles Pinto Center and the entire Jubilee to greater heights. He authored numerous articles and made many remarkable publications and orations, and contributed to chapters to textbooks. Awards came to him one following the other. The famous Joseph McCarthy Award for Excellence in Medicine and Humanitarian Services in November 2006. To mention, this award in 2006 had 11 lakh cash prize and a crystal memento. In 2006 itself, he donated the entire 11 lakhs for the treatment of poor pediatric children, pediatric patients. He also was a recipient of the Lifetime Achievement Award by the Kerala chapter of the Association of Plastic Surgeons, the Plastic Surgeon of the Year Award by the Association of Plastic Surgeons, TMA Lifetime Achievement Award, to name a few. He held several prestigious posts that were bestowed upon him in view of his expertise, which included the first president of the Indian Society of Cleft Lip, Palate and Craniofacial Anomalies. He was a member of the Medical Advisory Board Smile Train New York and Medical Advisory Committee Smile Train India. One of his precious advices to medical professionals was befitting in today's context. Do not enter this temple of healthcare mission with the soul of a money changer. Remember, medicine is about caring. There have been several cleft lip surgeons with great surgical dexterity in this world. However, Dr. Adenwalla was one of kind, having left an impression on the souls of his patients, friends, colleagues, teachers, trainees, and family alike. Dr. Adenwalla passed away on 27th May 2020. We are extremely proud to present the first Monsignor Mathew Muringathery National Level Healthcare Missionary Award posthumously to Dr. Hirji Adenwalla, poor man's doctor and the smile maker of this poor man's missionary hospital. Thank you.
Thank you, sir. Mrs. Gulnar Adenwalla, who has been the pillar of strength for Dr. Adenwalla throughout their life together, will now receive the award. I request all the family members to join on the stage. The award also carries a prize money of 50,000 rupees. I request His Grace to give away the check to Mrs. Adenwalla. Thank you, everyone. I invite Dr. Susanna Schaffer, the Executive Chair, President and CEO of Smile Train, to deliver the keynote address. Smile Train is the world's largest cleft focus organization supporting surgery and comprehensive cleft care in children. Smile Train's India program has already supported more than 5 lakh free cleft surgeries, giving children not just a new smile, but a second chance to life.
Thank you. Hello, everyone. I couldn't be more pleased than to be here in Trichy for these 2 special days and to be part of the families coming together, Jubilee Mission Hospital, Smile Train, and the Adenwalla family. I'm honored to share a few words in remembrance of our beloved friend, partner, and truly heroic smile maker, Dr. Hirji S. Adenwalla, who we lost on May 27th, 2020, at the age of 90. Thank you all for being here. I know Dr. Adenwalla touched all of us in some special way. And I can say with certainty that we are only a small fraction of the people whose lives were changed by this truly incredible man. I would like to extend a special thanks to Dr. Adenwalla's family joining us today, including his extraordinary wife, Gulnar, his son, who's an eloquent speaker, Firdaus, and his lovely daughter, Homai, her husband, Kumar, Dr. Adenwalla's son-in-law, Thomas, his beautiful granddaughter, Tara, who sings beautifully too, and his adorable granddaughter, Dia. This is a long-awaited celebration of life. And let me tell you, when talking about Dr. Adenwalla's life, there is so much to celebrate. Dr. Adenwalla was and he was devoted to cleft care for more than 6 decades of his long, remarkable life, and was indeed one of the pioneers of cleft surgery in India. In fact, he was one of Smile Train's first partners in the country. I had the pleasure of knowing Dr. Adenwalla as a colleague and a friend, and his life story never ceased to amaze me. In 1958, Dr. Adenwalla arrived at Jubilee Mission Hospital in Trichardt, newly married and fresh out of medical school, to find a hospital with only 20 beds, no doctors, and no patients. He and Gulnar moved into a small house on the hospital grounds with no ceiling fan and no indoor plumbing. And Dr. Adenwalla, well, he got right to work. In those early days, he ran the hospital himself, and he did literally everything. One remembrance described him as an all-arounder. He treated all ailments that he was presented with. This made him a general physician, general surgeon, pediatrician, pediatric surgeon, obstetrician, neurosurgeon, thoracic surgeon, surgical gastroenterologist, and urologist, all rolled into one. He was also his own anesthetist, radiology technician, and even the gatekeeper of the hospital, having to open the gates to let in emergency patients at night. But his first love was always helping children, and he developed a deep passion for treating cleft lips and palates. In 1959, he founded the Charles Pinto Center for Cleft Lip and Palate at the hospital as a one-man cleft operation named in honor of his former boss. The center was underfunded and did not have access to new equipment, but he used every resource at his disposal to give every child who came to him the care they needed. He operated this way for over 40 years until his wife read an article about a new organization called Smile Train that was looking to partner with hospitals in India to sponsor free cleft surgeries. She wrote to us about her husband, and in 2001, Jubilee Mission Hospital and Dr. Adenwalla became one of Smile Train's first partners in India. Over the next 19 years, Smile Train helped the Charles Pinto Center transform into a modern, multidisciplinary hub of cleft care and training, all with Dr. Adenwalla at its core. Smile Train helped Dr. Adenwalla receive the international recognition he deserved, but would have never sought for himself,
bringing him to speak at international conferences in cleft care, where he empowered even more doctors around the world through sharing his techniques and experiences. He truly embodied our teach a man to fish model. He also served on Smile Train's Medical Advisory Board in New York and was a founding member of our Medical Advisory Council in India. You heard earlier, he earned the prestigious Joseph McCarthy Award for Excellence in Medicine and Humanitarian Services in 2006. And Smile Train honored him with a Lifetime Achievement Award to mark our 500,000th cleft surgery in India in 2018. Through his long, impactful career, he never slowed down. In nearly 2 decades of partnering with Smile Train, he personally performed more than 3,700 life-changing Smile Train cleft surgeries. He continued to perform at least 4 cleft surgeries a week, right until the day he passed away in that same little house on the hospital grounds he and his wife, Gulner, first moved into more than 60 years ago. Today, I am proud, so proud, as the Cleft Center at Jubilee Mission Hospital continues to thrive under the able leadership of Dr. Narayan and his team, carrying forward Dr. Adenwalla's legacy and his passion for cleft care. Dr. Adenwalla was a model of kindness, devotion, innovation, and compassion, and his legacy will live on forever through his thousands of students and the tens of thousands of smiles he left behind, including those on each one of our faces. In the hearts and minds of everyone who was fortunate enough to know him, and through his lasting impact on countless lives and communities, Dr. Adenwalla will never be forgotten. Thank you so much.
Thank you, ma'am. Let me invite Shri Rishraj Singh, IPS, former DGP, for felicitation speech. This veteran IPS officer is a man who showed strong commitment to his duties and never wavered in taking tough decisions. He's also admired for his literary talents.
Respectable members who are sitting on dais, Ms. Tara Kumarvelu, Reverend Father Shri Rene Mundan Korean, H.G. Mal Jacob Shri Thumkudi, Dr. Benny Joseph, Ms. Susanna Sheffer, Ms. Mamta Carol, Mrs. Gulnar Adenwalla, and all the rest of the family members of Shri Adenwalla, Dr. P.C. Gilvez. Respected other dignitaries, doctors, organizers of this function of and other respected guests, ladies and gentlemen. I am immensely enriched by listening to talks given by Dr. Firdaus. His description and other details given for his father, Dr. Hirji Adenwalla, was simply marvelous. I am here at this institution since last 2 days, and I have been meeting many people, including doctors also. This place speaks of any number of stories and tales and human service delivered by Dr. Adenwalla. I myself have been a patient of cleft lip and cleft cleft lip and this cleft inside the mouth. I wonder that had I knew his name from 1961, or my parents would have somehow come to know about his name from 1961 to 1967, he would have just got me rid of this problem long back. Since I didn't know anyone and there was nothing else to be done in the state of Rajasthan, I had to wait till a full-fledged plastic surgery department had to start at PGI Chandigarh. As Dr. Firdaus said, Dr. Adenwalla belonged to Ahmedabad, and when he was 20 years of age, he saw an advertisement and that a pediatrician at that time, not the specialist, what in the terms which we talk about now, was needed at this hospital. And as the rest is the history, as he came here, and it seems that the figures I was being told by his family members, he has worked here as a doctor, as a cleft specialist for 61 years, and he has operated not less than 50,000 operations, 23,000 or so by himself, and remaining 27,000 as part of Smile 10 program. That is a stupendous work. Now it is, it leaves me to wonder why his name so far has not been considered for any of the Padma Awards. Doctors are always being considered for the Padma Shri, Padma Bhushan, Padma Vibhushan Awards or so. His case remains important by its absence. But then I was talking to Miss Carol on the stage yesterday. He himself detested with this very idea. He hated publicity in any manner. Miss Carol was saying that if any of his program would come on TV, he would not like it. And when everything will go, when all the others will go away, he will even admonish his people who were working nearby to him. Maybe one of that reason, but that still remains. He didn't like, that doesn't mean that his name should not be considered. At the time when the far more important the international awards have been given to him. I am honored to get acquainted with an illustrious program like this being held in the loving memory of Dr. Adenwalla. Now, he had a desire to start a program for providing financial help for treatment of financially poor pediatric patients. I am very happy to announce that his dream about the start of Pediatric Charity Fund is going to be fulfilled today at the behest of the Jubilee Hospital and Smile Train organization. Thank you very much.
Sir, I request Sri Rishraj Singh IPS to announce the Dr. Adenwalla Memorial Pediatric Charity Fund.
I am pleased to announce the Dr. Adenwalla Memorial Pediatric Charity Fund. Father Reni Mundankerian, the Director of Jubilee Mission Medical College and Research Institute, will receive the first contribution from Mr. Sebastian TC, who was a part of Jubilee Fraternity for the past 2 decades.
Thank you, sir. Thank you, Father. Reverend Father Paul Peramangalat, former Vicar General, now Director MI Hospital Engundur, will hand over the token of our love and appreciation to Sri Rishraj Singh. Thank you, Father. Madam Mamta Carroll, Senior Vice President and Regional Director of Smile Train Asia, is in charge of Smile Train activities in South Asia, Southeast Asia, and MENA comprising 19 countries. She leads Smile Train's Asia team in extending the reach and impact of the program. She will now announce the Dr. H.S. Adenwalla Smile Train Fellowship in Cleft Lip and Palate, sponsored by Smile Train.
Dr. Adenwalla fully embraced Smile Train's Teach a Man to Fish model by training, mentoring, and guiding young cleft surgeons and medical professionals, not just in India, but worldwide. In his memory, Smile Train is proud to announce the H.S. Adenwalla Smile Train Fellowship in Cleft Lip and Palate at Jubilee Mission Hospital to ensure that we carry forward his legacy by enabling the next generation of cleft surgeons to follow in his footsteps and continue to transform lives and the lives of children with clefts. I'm pleased to award the first H.S. Adenwalla Smile Train Fellowship in Cleft Lip and Palate to Dr. Divya Arunachalam. Dr. Divya Arunachalam is not here today, but I request Dr. Narayanan to please accept our support for this first fellowship and convey that to Dr. Divya Arunachalam when you meet her next. Thank you. Thank you.
Thank you, ma'am. Dr. Varghese PR, the Research Coordinator of JMMC and JCMR, and the Organizing Secretary of the function, will present the memento to Madam Mamta Carroll. Thank you, sir. His Grace will now announce the building dedicated to Monsignor Mathew Muringathery, the founder director of this institution.
The Golden Jubilee block of Jubilee Mission Hospital, Medical College and Research Institute will hereafter be known as Monsignor Mathew Muringathery block.
Thank you, His Grace. Dr. Susanna Schaffer will now announce the building dedicated to Dr. H.S. Adenwalla.
The Diamond Jubilee Block of Jubilee Mission Medical College and Research Institute will hereafter be known as the Dr. Adenwalla Block.
Madam, we highly appreciate your presence in Jubilee and would like to express our love and gratitude to you. Reverend Father Thomas Pupadi, Assistant Director of Jubilee Mission Medical College and Research Institute, will do the honor of presenting a memento. Thank you, Father. Thank you, Father. Now we have the announcement of Dr. H.S. Adenwalla Institute of Cleft Lip and Palate, and for this, I invite Mrs. Gulnar Adenwalla.
Announcing the launching of Dr. H.S. Adenwalla Institute of Cleft Lip and Palate, which will include the Charles Pinto Center as a surgical wing and also other ancillary specialities like speech, pathology, orthodontics, research, etc.
Madam will now share with us her memories of Jubilee and Dr. Adenwalla.
Dignitaries on the dais, ladies and gentlemen, good evening to all. On the outset, I must thank His Excellency, the Father Director, Dr. Benny, doctors, nurses, and the JMH team conferring the honor on my late husband, Dr. H.S. Adenwalla. As you all must have heard, that it was one of his earliest dreams to devote his life to medical missionary work, and he had plans to go to Africa. This never materialized since he wished to marry me, and the two did not go hand in hand, as both our parents refused to allow him to take a young bride into the depths of Africa. The hand of Providence came into play by him answering an advertisement in the Times of India wanting a young surgeon and chief medical officer for a post in a mission hospital in Trichur. Little did we realize then when he got the job that he would make this his life's work and our home for the next 60 years. When he first stepped off the train at Trichur railway station in 1959 with Chotu, the person entrusted by his mother to look after him, Father Mathew had never met Dr. Adenwalla, but he was there to welcome him. And he was unaware of my husband's dress sense. So he went straight to Chotu, who was better dressed, stretched out his hand and said, "Welcome, doctor, welcome." Poor Chotu, who did not know a word of English, didn't know what had hit him, till Dr. Adenwalla gently intervened and corrected father. Both had a good laugh at the mistaken identity. From the start, there was complete understanding between both of them. They were kindred spirits. Both their objectives were the same, providing good quality medical care for those less privileged. It was an uphill task, but they, along with so many dedicated people, made it happen. Father went all out to make us at home, to make us feel at home, especially me. Besides being a kind man, he was also clever and realized that if Dr. Adenwalla had to stay on, Mrs. Adenwalla was to be kept happy. and so my every request was granted. My husband would keep a letter of resignation in his pocket and flourished it if things didn't go his way, like getting some equipment, or if father did not seem keen on developing a new department. At first, father took him seriously, but soon realized it was all a ploy and that the doctor wasn't going anywhere. It became a standing joke between them. I remember Father Mathew coming home in the evenings and sitting out in the garden and talking, not only about the hospital, but about religion, philosophy, and life in general. He was a very kind, simple, and considerate man. Every evening, he would go around the wards and would take time to listen to the patients and their relatives and do his best for them. I can ramble on with so many stories and anecdotes about our early life here, but I wouldn't want to take up any more of your time. However, before I conclude, I would like to show you the letter of appointment that was given to Dr. Adenwalla when he first joined. It was so simple and straightforward, though the hours of work specified in it makes me smile, because from day one, it was never followed. There were no hours of work. He just worked through the day and most times into the night also. He joined on 500 rupees per month. But when he got married, it was increased to 750 rupees per month. In those days, that was plenty for us. After 10 years of service at the Jubilee Mission Hospital, which was a landmark, I think Father was surprised that we had survived. He came to the house and gave him this letter, which I shall read to you all. It is so poignant and meaningful today when he has been given this award in his name. The letter reads thus. It's dated 10th August 1970. Dear Doctor, there are certain days in our life unforgettable which we recollect with special joy and gratification. So it is sweet for me to recollect that day, 10th August 1960, when you came here with sincere enthusiasm and zeal after being a master in surgery for selfless service in this hospital. We all were extremely happy then to welcome you, as we had already known on an earlier occasion the rare qualities of your head and heart. Since then, this hospital began to grow from day to day and from year to year. This fact nobody can deny, and I feel that I must proclaim it with loud voice, with deep feelings of gratitude. 10 years are now rolled off, a decade worth recording. A period of 10 years, no doubt, is a good part of human life on earth, especially when it is between 30 and 40 years of age. Looking back to the past 10 years of your life here, I find many things never to be forgotten in the history of this institution. From year to year, we saw progress, and there was no year with some new achievement. I do remember the days when we were seeking after nurses and doctors for their services here. But now, doctors and nurses rush in to get admission to this institution. For this wonderful change, who is mostly responsible? I know well that you don't want to receive high praise and public recognition of your services from anybody. But from my part, I deem it quite proper and fair to acknowledge them and record the same with gratitude. Hence this letter. But we had occasions to recollect that human life on earth is intermingled with joy and sorrow, delight and disappointment, that trials and tribulations are inevitable in our life. But as long as we stand for and seek after true peace and justice based on moral principles of right order, we need not be weary in well-doing. Dear Doctor, while I thank you for all what you have been doing here for the last 10 years, I also pray that God may be pleased to bless you with length of days, strength of spirit, health of body, and wealth of peace, to continue with untiring spirit and ever-increasing fruitfulness the noble work we have undertaken for the relief of the sick and the suffering humanity. With deep sentiments of esteem and gratitude, yours sincerely, Father Mathew Muringathery. Thank you.
Thank you, ma'am. We have come to the concluding part of the program. Dr. P.C. Gilvas, the medical superintendent, will express the vote of thanks.
Where do I begin? I am standing in the presence of two memories, of two people who have laid the foundation of this massive edifice. Where do I begin to say thank you to these two people who have laid the foundation of the ethos of this great institution? All I can say is that wherever they are, they probably are proudly looking down on this gathering and saying, well done, good and faithful servants. You have made this a day to remember. I therefore have great privilege and pleasure in welcoming what to me is a walk down memory lane. We have heard in the last few days the words three families, but I think at this point of time it is just one great family, united with a common goal. And therefore, I thank all of you for being here. People like Mrs. Susanna Schaffer, who has traveled from New York City right down to be with us. People like Miss Mamta Carroll, who has traveled down all the way to be with us. The entire Smile Train team. But above all, I must thank those who have gone before us, who have laid the foundations of this institution. I see before me people like Dr. Sunny George, Dr. Menon, Mrs. Valsa Paul, who incidentally is the wife of another huge pillar of this institution. Somebody whom I can never forget. Somebody I think along whose lines I have modeled my own life. A very strong person, Dr. Varghese Paul, who stood like a colossus along with Dr. Adenwalla in these times. Let us never forget him. A great man who always gave his support at the weakest point of the hospital. I also see before me people like Dr. Ramkumar and his family, Dr. Desai and his family, Dr. Vijayanar and his family. So many of them. Dr. Menon. So many people who have made this institution what it is, who have laid the foundation stones, and from where we have raised an edifice which I hope is perfect in its parts and honorable to the builders. I again thank them for having laid this foundation stone years ago. We also have a very familiar face from every morning signing on the register, Sister Octavia, a person who was always smiling. Dr. Adenwalla used to call her Little Octavia as opposed to Big Octavia, who was in the theatre. Sister Mary Guy, who was in fact a niece of Father Mathew Muringathery. My friends, this has been a stupendous and a very emotional evening for me, because it has marked that years have rolled by. Years which have been fruitful. Years which have seen this institution grow. And I thank all of you who have been part of this growth. Your Grace, Ma Jacob Tunguri, you presided over the transition of Jubilee Mission Hospital into Jubilee Mission Medical College and RI. I thank you from the bottom of my heart. You could not have done a better job. Our DGP, Mr. Rishi Raj Singh, has always been with us, a familiar face on this, on the scenario of Kerala, whether it be in the police or whether it be in social activities, and now part of this great evening. I must also thank people like Mr. Rajkumar of Lakshmi Trust for being with us, His Excellency Bishop Sebastian, who has come all the way from Malaysia to be with us, and all of you who have made this a memorable evening. Thank you all so very much.
Thank you, sir. Thank you, everyone, for being with us. It was a pleasure to have you all with us at Jubilee. The tea is served to your left side. Thank you so much. Excuse me, the tea is served to your left side.